Healthwatch Cornwall's A Good Death conference came about as a result of some work that Healthwatch Cornwall did last year, where we looked at people's experiences of end-of-life care. Well, today's event is really about collecting all people's ideas and views on how the system could be made the best it could possibly be for Cornwall. So with that information, we'll be looking to form a charter for end-of-life care in Cornwall that all parties can sign up to and put in some recommendations to the commissioners.
I think today's end-of-life conference for Cornwall, looking at how we can ensure more people have a good death in Cornwall, is a really important event. At the simplest level, even to be talking about it, it's one of those taboo subjects. We just don't like to talk about a period of ill health, the end of life and death. For a start, I think we need to look at what is available in Cornwall. I was very pleased with the research that Healthwatch did. That really identified that lots of people who are working or in contact with people at the end of their lives don't realise the choices that are available to people, the service and support that is actually available, even professionals, dedicated, hard-working professionals. So by bringing people together today from the voluntary sector, the hospice movement here in Cornwall, from the acute NHS services, community health services, commissioners, Cornwall Council, this is a really good opportunity for them to find out, to learn from each other.
The Graceful Death exhibition started in 2007 with the death of my partner, Steve. And behind me you can see Steve standing with the blue background. That was when he was well and had his diagnosis, and from that he went to his death in 2007, and that's a painting of him on the day of his death. And then I began to be asked to paint other people at the end of life. So Steve's story having been done, I started to work with other people and ask them who they were and what they wanted to say. And the exhibition here is about people's stories, about how they're approaching the end of life.
I really want to get out and about and meet as many people as possible and hear from carers too and the bereaved actually about what their experience has been like for end of life, and also to try and see if we can start to put some recommendations together to actually bring back to the public, to actually think about what our strategy is going to be for the future for end of life.
Healthwatch Cornwall is an amazing organisation that is absolutely dedicated to making sure that patients have a strong voice